call it. It's Wednesday. Today on Your Health, we're going to take a look at polio, where we are as a country. But just to kick off this interview, I'll define what polio is really. Is a crippling and potentially infectious disease. Dr. Collins Tabu is here this morning to help us understand and go through this even deeper. Dr. Collins, thank you so much for your time. What causes polio? Let's begin with that.
Yes. Thank you, Nzenzi. Polio is caused by a virus. The virus is spread in much the same way like cholera is, like typhoid is, like intestinal worms are. The virus is spread through contaminated food. Let's say if people use the washrooms, they do not clean up after them very well, and they get that contamination into food, or through grating or through droplets as we breathe in. The virus gets into our bodies through the intestines. It's able to penetrate the walls of the intestines and get the blood to the bloodstream. And what it does is that it has a liking for the nerves. The nerves are the tissues that control our movements, control our thinking, control all our actions. And much more specifically, it spreads along the nerves to the brain and to the spinal cord, and it destroys the areas in the brain or the spinal cord that do control our arms or our legs, and we therefore get paralysis.
So one way of spreading is hand-to-hand and not washing?
Yes, it's actually fecal-oral, that if we don't take care of our hand sanitation very well, we don't wash hands after using the toilet, we risk spreading it to the next person through contamination in the food, contamination in the water as we greet them, or sometimes through droplets when we cough at other people, and they're able to get in the virus.
What are some of the symptoms that polio has?
Yeah, polio basically just causes paralysis. In the initial phases, you may have a bit of flu-like symptoms, maybe a bit of fever, but it quickly progresses within a few days, less than about a week, for you to develop paralysis. So you get sudden weakness in either the lower limbs, weakness of an arm or both, and so forth. And the weakness is floppy, that you suddenly are not able to walk, or you suddenly are not able to use your hands, and it's painless, largely.
And treatment around polio?
Unfortunately, there is no treatment for polio. So once you do get paralyzed, then we talk about rehabilitation, disability. What I also forgot to mention is that beyond that, in a few cases, you easily get people dying from that massive destruction of the nerves that does happen.
Wow. So
it just takes about a day for you to get a massive destruction of your nerves or brain tissue, enough for you to get paralyzed. Just
so there's no treatment, hence why now immunization of the disease?
Yes, there is no treatment for polio. So thank you, Nzinzi. I'll take you back a bit to what immunization is and how we get there. There are only two known ways for you to be able to prevent disease, and specifically in this case polio. For you to be able to protect yourself from disease, you either allow yourself to suffer the disease, and hopefully your body is able to fight the disease successfully and develop the immunity, in which case you risk dying, and in which case you risk the disability like what we see from polio. Or you can immunize yourself, that you can take the vaccine, and because the vaccine is made from alterated viral particles, the body is able to recognize those and therefore develop the immunity for disease. The vaccine is inexpensive, it's available, it's easily administered. It's a better route. There are two known vaccines for polio. There's the oral vaccine, which we give as drops. You may have seen it going all around the TVs, the campaigns and the health facilities. And we have another vaccine which is given by way of injection. In this country, we give the first dose of polio vaccine when a child is born. Immediately a child is born, or within those first 2 weeks. We give the second one at 1.5 months, then 2.5 months, and 3.5 months. When the child comes for the 3.5 months dose, we give two types of polio vaccines. We give both the oral one and the injection type of the polio vaccine. Each subsequent dose of polio vaccine builds on the immunity created by the previous dose that you really get to boost your immunity. When you finally give the injection for polio at 3.5 months, it further boosts your immunity. There are two objectives as to why we vaccinate. We vaccinate or immunize to protect the individual, but also the second objective is to prevent the spread in a community. That we look at both the individual and the community. That the individual develops immunity, but the community should have such immunity that they cannot shed the virus to be able to infect other people. Now, that is the essence of the repeated doses of vaccination. That is the essence of the subsequent doses of vaccination that are given.
All right, Dr. Collins, how safe is the immunization? A lot of parents, more so mothers, are very worried and they don't get their children vaccinated because they're not sure how safe it is. So how safe is it?
It is very safe. I want to assure our viewers, I want to assure our mothers that it is very safe. Vaccines, by and large, are given to people who are well. They're given in very minute doses because the objective is not to cure disease, but really to have your immune system identify these disease particles and allow it to respond. So it's given in very tiny doses that are otherwise very safe. Secondly, we have reactions from vaccines that most of the time are very mild. Parents might have noticed that occasionally when you receive a vaccine, you develop some mild level of fever. If you're talking about the injectable form of vaccines, you get some small swelling and irritability of the child around the place of injection. These are mild and expected reactions because then it signifies that the body is recognizing and responding. That's how you see a bit of that. But we almost never see the very serious side effects as expected. For instance, the very serious side effects expected from a polio vaccine would be in very extreme rare circumstances, it would cause paralysis. Very rare. In the whole world, in last year, out of 120 million doses of polio vaccine administered, we got less than 6 cases.
Of the side effects of that extreme?
Of the side effects of that extreme.
Okay.
We have had concerns coming from parents in terms of children developing cough, children developing fever, a bit of stomach upsets, diarrhea. Those do not relate in any way to the expected spectrum of side effects from the polio vaccine.
So the diarrhea, what you've all mentioned, it's not related to the polio vaccination?
The diarrhea, the flu-like symptoms is not, not related to the polio vaccination. It's not the kind of side effects that are expected of the polio vaccine. However, we have what we call a National Vaccine Safety Advisory Committee and a system in place to continuously monitor the safety of the vaccines just for so that we can be able to pick out any trends or any changes in trends that will be able to occur, and so far none has been picked up.
All right, Dr. Tabu, what comes to worse? You say that paralysis is what would happen. What comes afterwards for such a patient? What medically speaking, comes afterwards? You're talking paralysis as a very, very rare consequence of the polio vaccine that has never quite happened in this country. It's been reported elsewhere. That is one. Two, that particular patient would need to go through a rehabilitative process. We have given more than 100 million doses of polio vaccine in this country. We have had no paralysis reported out of that vaccine. Secondly, if you look at it as a consequence, as a rare consequence, you're talking about 100 million doses given, no serious side effect seen, compared to the risks of not vaccinating, such that you have out of every 200 children that get the polio virus, one person getting paralyzed. That is too serious. So the risks of not vaccinating far much outweigh the risks
of the vaccine itself.
All right, so recently we got a scare in Eastleigh with polio there. Do Kenyans and also Eastleigh residents need to worry about this discovery, and how different is it perhaps from previous ones?
Yes, thank you. We got a discovery of a circulating virus in Eastleigh. I want to state that this virus was isolated in environmental samples, in sampling of the sewage system in Eastleigh. As we move on to eradicate polio, we are not just looking for polio disease in human beings, but we're looking for polio disease beyond the virus beyond human beings, looking at the sewage system. So the finding of the virus in the sewage system in Eastleigh means there must have been some individuals within that area who are shedding off the virus, and that is why it was discovered in the sewerage system. So by them shedding off the virus, it means that the community is at risk of, first of all, contracting the virus, secondly, of having their children paralyzed from polio.
So that situation, should I say, quote to quote, has been contained?
It is being contained.
It is being contained.
It is being contained. That is the basis of the campaign that happened around May to immediately respond to the finding around Eastleigh. We had another campaign coming in July based on a risk assessment to look at which other counties are at risk, to look at the entire Nairobi and 12 other counties that have low immunization coverage, that are related to Nairobi in terms of migratory patterns, are related to the neighboring countries that put Kenya at risk of transmitting of polio importation, and we had the July campaign. We're following up with is being finalized today, after which we will do a risk analysis, and then probably that will inform the other interventions in September and October.
And speaking of that campaign, so far it has happened in May, like as you've said, in June, July.
Yes.
Dr. Tabu, do we know how many children have been vaccinated so far?
Yes, we
do. We have the numbers?
We have the numbers. For instance, for the ongoing campaign, we targeted to reach 2.8 million children. We have so far reached 90% of that target. We've reached about 2.7 million children by yesterday. We hope to exceed that target by the end of today. And we exceed the target not because we have looked for other people, but occasionally have people traveling through those areas which we are targeting for vaccination, and therefore they also get to benefit from the vaccination.
Talk about those areas. What regions are those that perhaps have the outbreaks, should I say?
Yeah, not most outbreaks that are at risk.
They are at higher risk.
Yes. We're talking areas that are bordering Somalia. That's the of Garissa County, Mandera County, Wajir County. We all know the health systems around Somalia, Sudan are not as good due to the war situation. We're looking at counties like Nairobi, because this is where the virus was isolated, and it was linked to the one that to the outbreaks that have been ongoing in Somalia. And we all know we have a movement of refugee populations between Nairobi, particularly Eastleigh, and the refugee camps in Somalia. So we have Machakos, we have Kajiado, we have Kiambu, we have Meru, just to name but a few.
Okay. Speaking of which, polio vaccination, the two counties that seem to be doing exceptionally very well and have exceeded the 95% coverage, Kajiado at 104% and Kiambu with 119%. What is it that Kajiado and Kiambu seems to be doing right as opposed to the likes of Isiolo and Meru, who did not achieve 5% target?
These counties have invested a lot in mapping of their communities, understanding very well where their children are, understanding very well the movement of people and the interactions with people around their countries. And they've invested a lot in the door-to-door strategies, that they are not waiting for the mothers to come to them, that they're going out to the community to knock on doors and get to vaccinate their children. They're camping in bus parks, getting the children, even those who are traveling through. They're going to schools, for instance, before the schools closed, churches and other social places, just to be sure every child is vaccinated.
Dr. Tabu, is this a clear indication that devolution works in terms of health, in terms of ministry at the county level, given Kajiado and Kiambu's performance?
Yes, this is a clear indication that devolution works, and it brings clearly the benefits of devolution by way of putting the decision making closer to the people, that the counties can be able to to organize themselves around the decision-making processes and make things work for them. So yes, this is one of the signs that it is successful.
All right. One of the things that you mentioned in terms of perhaps maybe regions that are performing very poorly, you mentioned Isiolo, Garissa, the ones that border Somalia, is the immigration around the as well as our neighboring countries.
Yes.
Then what would the government, or what would you advise the government to do in terms of perhaps working with other governments, especially around the border area when it comes to polio as the East African region?
Yes. Thank you. So we are already doing this. We are already putting in place measures to stem that. First of all, around that, we're partnering with the refugee agencies around the refugee camps to make sure that all the refugees, as they come in, they're vaccinated. We're in touch with KNHCR, with the refugees, the IRC, working around the camps. Secondly, we do have border posts screening for vaccination and getting those children or individuals that have not been vaccinated to get vaccinated as they do come in. Now, third, again, we have engagement with the other that the vaccines we decide the same they use on their side. For instance, as we do these polio vaccination campaigns, we're not doing them in isolation. We're going to have synchronized vaccination campaigns around the region involving Sudan, involving Somalia and Ethiopia, so that whoever is missed out on this side maybe has gone across the border, they are also not missed out, just to stem the spread of infection across the border.
All right, Dr. Tabu, as long as I have you here before I let you go, let's just quickly highlight perhaps other vaccinations with other diseases, just likely for our audience.
Thank you. So the government provides vaccination against 13 diseases free of charge through all public, private, and even NGO health facilities. This includes cancers. We have vaccination against liver cancer through the hepatitis B vaccine. We do hope to introduce another vaccine against cancer. This is the HPV vaccine against cervical cancer. These are given through the health facilities. They're given to the children before the children attain the age of 2. We're moving in to consolidate this further to say we're moving on to eliminate diseases. Now the government has already achieved a milestone by eliminating maternal neonatal tetanus. We're now targeting the elimination of measles and rubella, one of the diseases that causes huge outbreaks. If you will remember, on the 27th of last month, His Excellency the President gave a directive, a proclamation that he wants all the children who missed vaccines in the past to be vaccinated. You will remember we are coming out of last year when we had a long protracted health workers strikes. So we have been given 100 days as a ministry to get all these children vaccinated. So we have another array, rapid results initiatives, to get all the children that missed vaccines vaccinated. Beyond this, we have a directive from the President to ensure that all children are vaccinated before they join school. This is, we're working closely with the Ministry of Education and the county governments to make, Council of Governors, to make sure that this happens. This is in recognition of the fact that children in school stay in sort of like a closed environment. Immunization is our collective responsibility. You may do protect your child from these diseases, but if the next person does not vaccinate their child, that child still poses a risk to us. So this is the reason why every child must be vaccinated before they join school.
Thank you so much, Dr. Tabu. All right. Dr. Collins Tabu helping us understand where we stand as a country in terms of fighting polio. Congratulations to Kajiado and Kiambu County for respectively passing the 95% mark that was put, 124 for Kajiado, Kiambu 119. Let's take a quick breather. We'll be right back.